Hello, friends. Welcome back to Senior Wellbeing, where we talk about how to live healthier, longer, and happier lives after 60. Today, we're diving into a topic that might surprise you. Not all medical checkups are good for seniors. Yes, you heard that right. We've been told all our lives that more tests equal better health. But as we age, some checkups can actually harm us more than they help. So if you're over 60, grab a cup of tea, sit back, and listen closely, because what I'm about to share may save you from unnecessary stress, procedures, and even harm. We'd love to hear from you. Drop a comment below with where you're watching from, or any negative experience you've had before, or questions you have about senior health tests. We take our time to respond to each and every response and questions, giving further insight and advice. Your experience could help someone else too. Now, don't get me wrong, health checkups are important. Early detection of diseases like diabetes, high blood pressure, and certain cancers can save lives. But here's the truth. Not every test makes sense at every age. Some tests carry risks that increase as we get older. And some checkups can lead to false positives, telling you something is wrong when it isn't. What happens next? More scans, more biopsies, more surgeries, more stress. And sometimes all of that isn't necessary. So, today we'll go through which checkups and screenings may be harmful for people over 60. Why these risks increase with age. Safer alternatives and smart health practices you should focus on instead. And I promise, by the end of this video, you'll feel empowered to make smarter choices about your health. Let's start with a simple question. Do you believe that more testing always means better health? If you answered yes, you're not alone. Many of us grew up with the idea that catching things early is always best. And in some cases, like with blood pressure or diabetes, that's true. But here's the problem. As we age, the risks of testing sometimes outweigh the benefits. Think of it like this. Imagine you're fishing in a lake. If you cast a wide net, you'll catch fish, but you'll also catch sticks, weeds, and old boots. Medical testing works the same way. Doctors may find harmless spots or shadows in your body, things that would never hurt you. But once they see them, you may be pulled into a chain of stressful and risky procedures. For seniors who may already have other health conditions, those procedures can do more harm than good. This is what doctors call over-testing or over-screening. And it's something everyone over 60 should know about. Now, let's talk about specific checkups that you should think twice about. 1. Routine full-body scans, CT or MRI without symptoms. Sounds fancy, right? A whole body scan? Some clinics even market it as peace of mind. But here's the truth. CT scans expose you to radiation, and MRI scans often pick up harmless spots. Those incidental findings often lead to more testing, invasive biopsies, and even unnecessary surgeries. And for seniors, surgery carries higher risks, slower recovery, infections, or complications. So, unless you have symptoms or a strong reason, skip the full body scans. Some private clinics market them as peace of mind, but the truth, they often cause panic. For instance, one senior man went for a full-body CT scan. The scan found a small shadow on his lung. He went through multiple follow-up tests and even a surgical biopsy. After all that pain and risk, it turned out to be a harmless scar from an old infection. This is what doctors call a cascade of care. Once one test shows something, you get pulled into a chain of more and more interventions, many of which aren't needed. 2. Colonoscopy after a certain age. Colon cancer screening is important, but not forever. After age 75, the risks outweigh the benefits. Why? The bowel prep causes dehydration and kidney strain. The procedure itself can lead to bleeding or even bowel perforation. And most colon cancers grow slowly, meaning they wouldn't cause harm late in life. 21. For most people over 75, colonoscopies are no longer recommended. Talk to your doctor about less invasive stool tests instead. 22. Let me give you a real example. In a study published in the Annals of Internal Medicine, researchers found that people over 75 who went for routine colonoscopies faced higher risks of serious complications like bowel perforation, dehydration, and bleeding. One 78-year-old patient who had no digestive symptoms went in for a routine colonoscopy. Unfortunately, the preparation caused severe dehydration that landed him in the hospital with kidney problems. And the kicker? The test didn't find anything dangerous in the first place. This is why experts now recommend limiting colonoscopies after a certain age unless you truly need them. 3. Prostate cancer PSA test for men. The PSA blood test checks for prostate cancer. But here's the problem. Many older men test positive for slow-growing cancers that would never affect their lives. Yet, once the test comes back high, the pressure to biopsy and treat is strong. Treatments often cause side effects like incontinence or erectile dysfunction. So, for men over 70, routine PSA screening is not recommended unless there are strong symptoms. 23. Another case comes from PSA screening for prostate cancer. An older gentleman, age 72, had slightly elevated PSA levels. His doctors pushed for a biopsy, which led to surgery. The outcome? He suffered lifelong side effects, loss of bladder control, and sexual dysfunction. Later, doctors admitted the cancer was so slow-growing that it probably never would have affected his life. The test and the aggressive treatment caused more harm than the disease ever would have. 4. Mammograms for women over 75. Mammograms save lives for younger women, but after 75, the benefits decline. Risks of false alarms and unnecessary biopsies go up. If you're over 75 and healthy, talk with your doctor about whether to continue. For many women, mammograms may no longer be necessary after 75. 25. There's also evidence with mammograms in older women. Research published in JAMA Internal Medicine showed that mammograms after age 75 often lead to false alarms. Imagine getting that phone call, "We found something suspicious." Anxiety skyrockets. You go through painful biopsies only to find out it was harmless. One woman in her late 70s went through this exact situation. She spent weeks in fear, had unnecessary surgery, and later learned the lump was benign. Her quality of life was damaged, not by disease, but by over-screening. 26. Bone density scans, like DEXA, too often. Osteoporosis is serious, but repeating bone scans every year is not helpful. Bone changes take time. Scanning too often just adds cost and stress. 27. Every 3 to 5 years is usually enough, unless your doctor says otherwise. 26. Routine heart stress tests or imaging without symptoms. If you feel fine, no chest pain, no shortness of breath, you may not need yearly heart tests. These tests often lead to angiograms or stents that don't actually improve life expectancy for healthy seniors. 29. Stick to heart tests only if you have symptoms or risk factors. 30. Even heart stress tests can be problematic. The American Heart Association has reported cases where seniors with no heart symptoms were sent for routine stress tests. One case involved a 69-year-old woman. Her stress test showed a questionable result, so she was rushed for an angiogram. That procedure caused complications, leaving her weaker than before, when she had been perfectly healthy to begin with. 31. Too frequent blood tests and panels.
Sometimes doctors order dozens of labs just to check everything. While useful occasionally, too much testing can lead to false alarms and unnecessary treatments. 32. A focused approach works better. Ask your doctor which labs you really need. So why is this such a big deal? Let's be real. False positives. Imagine being told you might have cancer, only to find out it was nothing. The stress is crushing. Emotional stress, sleepless nights, anxiety, and fear can harm your well-being more than the disease itself. Physical harm. Extra procedures mean higher risk of infection, bleeding, or drug side effects. 34. Financial strain. Medicare covers many tests, but not all. Extra scans and follow-ups can cost hundreds or thousands of dollars.
So, as you can see, friends, the danger isn't just theory. These are real stories and real people whose lives were made harder, not better, by unnecessary checkups. That's why it's so important to make smart choices about which tests we truly need and which ones we should politely say no to. Friends, health is not about doing everything possible. It's about doing the right things at the right time. Now that we've covered what to avoid, let's focus on what seniors should do to stay healthy. Blood pressure checks. High blood pressure is the silent killer. Simple, quick, life-saving. Diabetes screening. A basic blood test helps prevent complications. Cholesterol tests. Key for heart disease prevention. Vaccinations. Flu shot, shingles, pneumonia. These really make a difference. Hearing and vision checks. Critical for preventing falls and maintaining independence. Fall risk assessments. Balance and mobility screenings are more important than many expensive scans. And here's the most important habit. Ask questions. When your doctor recommends a test, ask, "Do I really need this at my age? What are the risks and benefits? What happens if I don't take this test?" A good doctor won't be offended. They'll respect your right to make informed choices. Now, you might be wondering, why do these checkups become riskier as we age? Here's the truth. Our bodies change after 60. Healing takes longer. Kidneys and livers don't filter medicines as efficiently. Bones and tissues become more fragile. Even our immune system slows down, making infections harder to fight off. So a test that might be low risk at 40 or 50 can actually carry significant risks at 70. For example, sedation used in procedures like colonoscopies or biopsies can trigger confusion, dizziness, or falls afterwards. A simple CT scan exposes you to radiation that your body is less able to repair at an older age. This doesn't mean you should avoid all medical care. It means you should choose wisely. I often tell my patients, at this stage of life, the goal isn't just living longer, it's living better. And sometimes avoiding unnecessary checkups is the key to protecting your independence. Another reason harmful checkups happen is something I call the fear factor. We've been trained to believe that if we don't test, we're being careless. But let me ask you, have you ever said yes to a test just because you were afraid of what might happen if you said no? Fear pushes many seniors into unnecessary testing. Doctors, too, sometimes overtest because they worry about missing something or facing lawsuits. But here's the catch. Overtesting often creates more fear, not less. Every false alarm means more sleepless nights, more appointments, and more stress. So part of protecting yourself is learning to say, "Doctor, can we wait? Do I really need this now?" That question alone can save you from months of unnecessary worry. Now let's flip the coin. If certain checkups may cause harm, what are the better, safer alternatives? Instead of a colonoscopy after 75,
ask about stool tests like FIT or FOBT. They're simple, non-invasive, and can still detect early warning signs. Instead of routine PSA testing, men can focus on lifestyle screenings, blood pressure, weight management, and urinary symptom tracking. Instead of mammograms beyond 75, women can stay alert to physical changes like lumps, nipple changes, or skin dimpling, and discuss them with a doctor if they appear. Instead of full-body scans, prioritize preventative care, healthy eating, exercise, and stress management. These do more for your health than chasing shadows on a scan. In short, don't stop caring for your health. Just focus on the tests and habits that truly improve your well-being. Let me share a story that brings this home. Mrs. Johnson, a 74-year-old retired teacher, went for a routine full-body scan as part of a special health package. The scan picked up a small shadow in her lung. She spent months going through follow-up CT scans, a biopsy, and countless sleepless nights. Finally, doctors discovered it was just scar tissue from an old infection, nothing dangerous at all. But during those months, her health declined, not because of disease, but because of stress, radiation, and repeated procedures. Now imagine if she'd simply skipped that unnecessary scan. She would have been living her life, gardening, enjoying her grandkids, without the burden of worry. Friends, sometimes the best medicine is peace of mind. So here's the big takeaway. Health is not about doing everything possible. Health is about doing the right things at the right time. At 60 and beyond, your job is to protect your energy, your independence, and your joy. Don't let unnecessary checkups steal that from you. So let's wrap this up. As we get older, our health decisions matter more than ever. And sometimes protecting yourself means saying no to unnecessary tests. Remember, more testing is not always better. Focus on screenings that truly improve your quality of life. Be proactive, but also be smart. If you found this video helpful, please hit that like button, share it with a friend or family member, and subscribe to Senior Wellbeing for more expert tips on staying healthy after 60. And now I want to hear from you. Have you ever felt pressured into a medical test you weren't sure about? How did you handle it? Have you ever gone through a medical test that turned out to be unnecessary or stressful? Drop your answers in the comments. I read and respond to every single one, and your stories help others in our community too. And don't forget, hit the like button, subscribe to Senior Wellbeing, and share this video with a friend who might benefit. Together, we can build a community where seniors take control of their health with wisdom, confidence, and peace of mind. Until next time, stay strong, stay informed, and remember, your health is in your hands.